Okay. Our 5 o'clock speaker is Dr. Beth Ebel. Let me just tell you a word about her background. Dr. Ebel got her MD from Harvard Medical School and an MPH from University of Washington. Did her training in pediatrics at Johns Hopkins. She's been a member of the faculty here since 1999 and is presently associate professor in pediatrics as well as director of the Harborview Injury Prevention and Research Center. Her main research interests are in prevention of injury to children, especially she's published a great deal about that in the setting of motor vehicle accidents. But today we're going to talk about head injury. Dr. Ebel.
I don't know. We may need to get her back to her slides.
I think we're right there.
Thank you for this invitation. Thank you, Nick. I'm afraid I won't use the word transsynaptic membrane potential in my talk at all. So I apologize. Let's see. Is that okay? Can people hear me all right? Great. All right. So in addition to working Injury Center, I clinically work at Harborview, as most of you know. It's the level 1 trauma center for 22% of the United States landmass. And I was on service there taking care of children who were coming in right at the beginning of this year. And, you know, I think every time I spend time at Harborview clinically, it kind of gets me to be motivated and think a little bit more about the research for injury that we do. And I can just give you a little sample of what came in. We had a girl who was riding an ATV and amputated her arm. We had an unhelmeted bicyclist, and Dad said that he had 4 helmets, but that they were in the closet. We had 2 full cars of teens, all unrestrained, drivers killed in both instances, seriously injured passengers. We had an unhelmeted fellow with a devastating ski injury, a gunshot wound, a child abuse case, and actually a great miracle too. That was a real save. So we get all things, but when I think about it, many of the injuries that we see, they're truly preventable with what we already know. And I think that's one of the challenges that we face in public health. There's a lot that we've learned about what's effective, and I think one big gap that we have is still trying to get these things to be put into practice. And the research around that behavioral science, is really a critical interest of mine, but I think something that's interest to all of us who are interested in seeing the advances of science applied. So I want to talk today a little bit about the burden of injury that we see and how that affects the brain. I'm not a neurosurgeon, but I would naively say that it appears to me from the trauma perspective as a pretty unsatisfying science. There's just nothing that you can sew. There's not much we can do. We can fix your arms, we can fix your legs, but we don't do much for your brain. So the money for the brain at the moment is really on prevention, primary prevention and secondary prevention of injury. A recent study that was published was looking at patients, 33 adults, for instance, with bad head injury, and I think a fifth of them were dead, a fifth of them were in a vegetated state, and out of the whole group, 5 out of 33 were able to return to work. It just points out what the impact is sort of beyond the current time. So what about injury? Well, a lot of people don't think as much about it, but if you look at the disability-adjusted life years, and this is basically, we all die of something. So this is basically trying to quantify what is the real burden for the years of life, productive years of life, for folks in the United States. This may be surprising to folks. Depression and alcohol is about 1/3 of all the disability-adjusted life years lost in the United States. Cardiovascular disease, including stroke, is second, but really closely tied with intentional and unintentional injury. So it's a huge chunk of the mortality and morbidity for young and old healthy people. It's above cancer. It's actually equal to the sum of many of these, HIV infection, diabetes, really a huge impact that's often under-recognized. In Washington State, you can see by age group here what the important role of injury. For young children in our state, unintentional drowning is the leading cause of death. And as you get older, it's motor vehicle injury and traffic, as well as suicide and violence that start to be important contributors to death. In our state now, we have a very high rate of seatbelt use. So actually, for the first time, the leading cause of injury death in Washington state is now poisoning. So that's just a new finding. But it really has something to do with the fact that we're second in the nation for seatbelt use. So there is progress. We are making progress, but there's still a long way to go. The Injury Center has been around for 25 years now, and as such we've had a chance to really see the history of the evolution of research put into action. So it was founded in 1985. Here's an example of sort of the long time course of adoption. In 1989, Fred Rivar and colleagues did the first study looking at the effect of bicycle helmets. And eventually a Seattle helmet law was passed. We still don't have one for Washington State. When you go around, you'll see lots of folks with helmets around here. But still, on the road, there's a lot of people without them. And certainly at Harborview. Motorcycle helmet law was passed in Washington State, in part based on the cost study that was done at the Injury Center. We've done some important and interesting work on alcohol interventions to try to reduce drunk driving, and that is translated into recommendations for the Committee of Trauma that now do an intervention for injured folks with alcohol on board in the hospital. At a place like Harborview, that's 40% of all injury, including old ladies who fall, pedestrians, and drivers. We've done work on the Washington booster seat and had the first law of booster seats in the nation passed here, walking school bus to reduce pedestrian injury, and some recent data on trauma center mortality that I'll share with you in a little bit. So there's been a lot of good work. When you think about injury, one thing you'll notice is that I don't use the word accident. And I don't use it because it kind of has this connotation of just bad luck, something that just happened to you. And that's really not how we think about injury anymore. It's a preventive issue with basically distinct etiologies and distinct steps where you can intervene. And so when you look at injury, you can see, you can start to learn a little bit more about the strategies for preventing injury and brain injury if you consider this structure. So there was a smart guy named Haddon who came up with this, what they call Haddon's matrix. It was really a chance to look at factors that are related to, preventing an event from happening in the first place, factors that could protect you in the nature of an event, and then post-event factors. And then he looked at host factors, factors that were related to the person herself, factors that were related to the agent of the vehicle, and then factors related to the environment, and really like to expand that to consider the physical and the social environment. And that's what I'd like to kind of go through today, to think a little bit about brain injury, and really to give you kind of a potpourri of some of the new issues that are coming down the pike, some new interventions and ideas that we hope will help reduce brain injury. So in this first category, some examples of things that would prevent crash would be distracted driving, and I'll talk to you a little bit about some research that we're doing there. Drunk driving, it's an area where we've seen a reduction in the prevalence of drunk driving, but it's still incredibly common. And I'll talk to you a little bit about helmet use, protecting the brain. How many of you here would tell your children that they have to wear a bike helmet? You're all say. And then how many of you on your own would wear a bike helmet? Okay, so that's the beauty about neurology. It's wonderful. My own father still curses me because I forced him to wear a helmet and some moment of weakness. And, I think it's just really, it's still something, as you look around, you'll see that there's still not a lot of helmet use. Bike helmets were shown to reduce the injury, for head injury, by about 85%. And actually, they protect your upper face as well. They're highly effective. That's true despite a column you might read in the New York Times today, or I guess it was maybe 2 days ago, talking about bike helmets and the reduced rate of riding. Well, there's a reduced rate of riding, and that's because people spend a lot more time with video games. It doesn't have to do with their dislike of a helmet. It's the same reason why we've seen an incredible reduction in pedestrian injury. The sad fact is that children don't walk to school. They don't bike to school. So those are the factors that are really the real underpinnings for the reduction in bike exposure. But when you are biking, a helmet is clearly strongly protective. Ski helmets are protective as well, but less so, and there's still some debate, I think, for snowboarding and ski boarding, what's going to be the best form of protection for them. But they're not often used. More and more on the ski slopes you'll see this. But in my entire time at Harborview, I've had 2 kids who have not had a helmet. They tell me they don't have one, and we provide one for them. Every other case, the kid has a helmet, but it's in the closet. So you can see, I think, the challenge that we have to motivate this. There are laws, but they're not enforced. It's a normative law. Ski areas can do something about this. ATV drivers really have to enforce this on their own. So it's a real challenging issue to make this part and parcel of healthy and good risk-taking activity. Motorcycle helmets are a particular case. So we've seen a great reduction for cars in terms of motor vehicle crashes and a great improvement in safety for vehicles. However, all the improvements that we've seen with new cars, with airbags, with crumple zones, with side airbags, there's a track that moves the engine underneath the chassis so it doesn't plow into the driver. There have been incredible design changes for cars and roads. Those have all been undermined by the incredible rise in motorcycle deaths. This has completely flattened out the improvements that we've had in motor vehicle fatality rates. And it's the reason behind it is really a couple things. One is that we have a lot more people riding motorcycles, and that's gas price related. Another fact is that many states have rolled back their helmet laws. And in those states you'll find some of them, like Colorado, have a huge organ donation program. So it's got some other, I guess some other benefits, I suppose. In our state, we have fantastic helmet use, but what we have that's interesting is a large use of what is called novelty helmets. These are sold on motorcycle websites, on their helmet sites. The folks here at the Washington State Patrol say that you can go and buy them, and you're supposed to have a Department of Transportation sticker on it that says it's an authorized helmet. But you can actually, easily buy those as well. And the police at present are not allowed to enforce the helmet law to check what type of helmet you have. That's been explicitly written into the motorcycle helmet law. So in our state, the protest vote is these folks that you see with a little tiny cap on their head, and you'll notice there's no thickness to it at all. That is a fake helmet. It basically is a child's, plastic helmet with no protection for the brain at all. So it's really the helmet use, plus the prevalence of motorcycle riding that has led to this incredible increase in motorcycle helmet deaths. Sometimes in the United States, we can learn a little bit from what happens in other countries. And one great example of progress here is really from Vietnam. So Vietnam, again, for economic reasons, everybody's on a motorcycle. They have 22 million motorcycles in a country with 86 million people. And they decided that they were sort of sick of having deaths and brain injury from this. In December 15th, they passed a law requiring motorcycle helmet use in Vietnam. And they basically, the next day, they'd advertised this and told people about it. They got local helmet production, and basically they were able to get from about 5% to 95% helmet use overnight. It's really a staggering accomplishment. This is the kind of travel that you saw before that time. You can see I have 5 people here on this vehicle, and it's not like this doesn't still happen. But here is a roadside helmet shop in Vietnam, so you can just stop by and pick up your hat. They called these rice cookers for a long time because people thought they were, hot on your head and they didn't want to wear them.
Were they free?
They're not free. They're made locally, but they're inexpensive. And like many other car products, this is not for the poorest of the poor. The poorest of the poor don't have a motorcycle. So you have a motorcycle, you buy gas for your motorcycle, and the relative cost of this is generally affordable for most people. In the market, and like many other things, I think if there's no economic incentive to sell this and you don't purchase it, it's simply not used. So that's been an incredible accomplishment. They've seen a 50% reduction in their head injury, the serious head injury cases, just from this, the passage of this law.
So what do you think? In
Yeah.
Vietnam, overnight,
Yeah.
they could get go from 5% to
Yeah.
95%.
Yeah.
And in our country, motorcycle helmet use is how close to 95%?
Well, Washington State is about 98%. So Washington State enforces their law. There's a healthy fine. And I think it was passed here in large measure. I mean, I think the initial thought was, well, if you want to kill yourself, it's your own darn fault. Fine, kill yourself. But when you really look at it, and that's one of the studies that we did, it's important to look at the economic costs that are really foisted on the rest of us from motorcycle helmets. So really, their insurance doesn't cover other motorcyclists, and their benefits go quickly, for a brain injury. So when you really looked at it at the end of the day, they took money from the pockets of Washingtonians to pay for motorcycle injury. And that was really, I think, the piece that enabled the legislature to vote to pass that law. So I think that's one important piece to appreciate. It's really not an act of individual freedom. So it's a great question. But some of the biggest states, Texas, Florida, Colorado, they have no law at all. And to me, what's interesting is that they used to. So there's a political will. Let's talk a little bit about teen driving and some issues that we can do to improve vehicle safety. So I'll ask you again, who here would counsel your teen not to talk on the phone or text on the phone? Okay. And why don't you leave your hand up if you never do that? Okay. So this is one of those issues where, do what we say but not what we do. So it's an important issue, and let's just talk about it a little bit. I mentioned backup cameras just to say that one of the saddest things I see are backing over injuries in vehicles. You cannot see kids behind you, and that's another technology I think that's coming down the road in minivans. So here's a cartoon. I don't know what happened, officer. I was just texting my friend about how totally unfair the new teen driving rules are, and the tree just jumped out in front of me. Texting is a very risky activity, and so is talking on the phone. Driving for teens in general, really, they're terrible drivers, just has to be said. They are learning to drive, and many teens consider it sort of a rite of passage. It's their God-given right to drive when you do surveys on it. But unfortunately, they're 6.3% of drivers, but almost 13% of motor vehicle deaths, and 16% of police-reported crashes. And really, these are almost all their faults. They have this high risk of crash. But interestingly, when your parent is in the car with you, you practically have no crash rate at all. So the second the parent steps out, your crash rate increases 700%. So there's something about the parent being in the car. It's a second pair of eyes, but it's also the way that the teen's behavior changes that really prevents injury. In 2006, we had almost 7,500 kids who were killed in fatal crashes, or involved in fatal crashes, and 3,500 of them were killed. Teens are risky for a number of reasons. And this is interesting. You can't actually predict. You've all probably heard about the good grade incentive, so if you get your insurance, you guys were all probably, straight A kids who got tickets to the ball game. Well, then you got a discount on your driving insurance, and that's still true. But when you talk to the insurance companies, they only do that because people expect them to, and they'll lose the whole family as a client. But actually, your grade point average is not related much at all to your crash risk. So it's not something that you can kind of take comfort in. There are different risk profiles. Some kids are risk takers, and these kids. They're the ones who pass you on the ski slope, and you see them. I saw this dad the other day. He had his kid in a stroller. It was near the edge of a cliff in California. He sort of let go and catch it. Let go and catch it. And I thought, that just isn't a behavior I would be doing. But it's just kind of like testing, He's got good reflexes and he wants to put him to the test. You've got some people who just are risk unaware. And this is what learning is about. You really don't know how far your stopping distance needs to be in front of you. You just don't know that you have a blind spot when you're merging. They're risks that you are unaware of. And then a very pernicious group is this distracted driver, phoning, texting, talking to your friend, eating in the car, conducting your whole life in the car. And this is very common. And as you know, this is what our kids are spending huge quantities of their life doing outside of school. Like everything else, if you are good at your job, you've done it 1,000 times. And when you do it 1,000 times, you will continue to do it well. And that's what we've taught our teens. They text and talk on the phone, from the beginning of junior high. And by the time they're 16, it is a very deeply ingrained behavior. And that thing sitting next to them in the car, when it rings, they're going to pick it up. So this is a big challenge. This is an interesting fact. They did a study with truck drivers, and they observed them texting, and in fact lots of truck drivers communicate on a regular basis with text messaging on the road. The risk for a truck driver was 24 times over the control group for text messaging. And to put this into perspective, a .08 alcohol level, driving with that, that's about a 4-fold increased risk. And now most people who are driving and are drinking don't have a .08 level. They have a 1.8 level. Talking on the phone when you're driving is about a 4-fold increased risk. And that's one of the reasons why many states have passed laws against it. Now, you can hang up the phone. If you're drunk, you're still drunk. So there's some advantages, you know, one over the other. But text messaging is over 23 times likely to increase your crash rate. For these truck drivers, as an example, in a 6-second period, they took their eyes off the road for over 4 seconds of that 6-second period. And during that time, their truck traveled over 100 yards. So, and that's without looking at the road at all. So just to get you a sense, you think you're not going to look at that thing very much, but the second you do, your attention gets sucked into it, and you have to push the buttons and try to respond. My own assistant is completely addicted to this. And so she's heard me talk on this subject a number of times, and I'm always struck by her insight into the behavior of her peer group. But she's told me a couple times, she said, well, I have to answer it in the car to let them know that I can't get back to them right away. And I said, really? And I said, well, what happens if we blocked your cell phone? And she said, well, I'll just drive faster to get to where I need to go. So I just want to appreciate, and I presented this to her class, and I said, what kind of interventions do you think we should do about this? And she said, one person said, well, I think we should just have fax, 4G phones, because they go so much faster that we'll be texting for less time. And someone else said, let's have a public information campaign to make sure that we use text messaging only at stop signs. So I'm just sharing this with you just so that you appreciate how incomprehensible it is to young people to not do this. It's just completely outside of their frame. And when I heard that, I just went back to myself and I said, this is an enforcement problem, because we're not talking them into this behavior change. So young drivers, they think probably it is risky. 87% of them say, yeah, text messaging is risky and you shouldn't do it. And cell phone, yeah, it's risky. 63% of them say. But 80% of girls are doing it anyway, and 58% of boys are doing it anyway. And so are all of us, right? So we know that it's not a good idea, but we're going to do it anyway. Let's see if we can get this to go. So this video here, this is a kid texting while driving. It has an in-vehicle camera, and the camera is split. Can you see that a little bit?
Maybe
So,
turn the lights down.
The camera is split so that the top half of the frame here is what she sees out the window, and the bottom half is the kid. And what I'd like you to focus on in this, I'll play it twice, but look at her eyes, because she's text messaging, and you'll see her go up and down looking at her text device. Radio's on. See, looking down, 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 and then look. Oh, oh, oh. And so, she almost backs in this car. Now she goes turn down the radio. So that's the kind of typical thing you see. Someone's kind of trying to share their attention, and they rear end the car in front of them. Let's see here. If I can get out of this now. All right. It's hard to do it here. Okay, so what might work? Well, driver's ed sounds great. Unfortunately, driver's ed is associated with an increased crash rate. It doesn't work at all to prevent crashes. And I imagine if you thought about it, you could think of why. It's probably not that they teach you to be a terrible driver. It's they let you get on the road early. And when you're young, you're dumb. So if you get access to the vehicle at 15 or 16, you are a worse driver than someone who's a new driver at 17 or 18. So driver's ed basically provides very early access to the vehicle and is associated in every study that's been done with an increased risk of crashes. It teaches you the rules of the road, but it simply can't teach you how to drive. So that's not going to do it for us. There is a graduated driver's law, and these have been shown to be effective. They have a restriction on the number of passengers you can have in the vehicle. they restrict nighttime driving, and they have a zero-tolerance alcohol policy. So you can't have any alcohol in your blood for new drivers. The trouble with them, I think, is that they're not enforced much, and the riskiest people are probably the ones who are most likely to not enforce this. And frankly, I think the other issue, and this is something important for us to keep telling ourselves if we're interested in public health, people don't change their behavior based on safety messaging or risk. It would be so great if they did, but they don't. People make driving decisions based on things like convenience. You know, your daughter's got to get to soccer, your neighbor's driving, you're carpooling with everybody else. So you tell your kid to drive with the other person. They're convenience-based decisions, and they're not based on safety. So we've got to recognize this if we're going to change behavior. So the trouble with graduated driving laws is probably the people who least need them are the ones most likely to follow it, and the riskiest people are the ones who probably don't care much about it. Strict alcohol laws are also effective for teens as well as for adults. So what's kind of new? Well, one thing that's new is this in-vehicle monitoring devices. And that actually, the clip I showed you is from one of these. There's some programs now that install a camera in your car. They're event triggered. So if there's a sudden acceleration or swerve, it snaps a picture and actually caches in its memory the last 10 seconds and the next 10 seconds and saves that cache if the accelerometer is triggered. And then this is loaded up to a website where they are summed and scored, and they are mailed conveniently back to your parents on a weekly basis. So that parent now gets to see how risky you are relative to other teens. And there's no debate because it's not like, oh, Mom, it was just the pothole I drove over. They can see perfectly well exactly what happened. And these videos are stunning because these kids, they know they have a camera in the car, but they still just behaving the way they want to behave anyway. And you'll see these kids go, they're driving along, they almost hit something, they swerve off the road. And I remember one where you see the girl doing it, and she swerves off the road, and then she looks up at the camera, she's like, sorry, and she buckles her seatbelt. So sobering. So, this is something that can be considered, it's a costly technology, but also teen drivers are costly. And in fact, the insurance rate that a teen driver pays is about 1/3 of the cost of that driver. Sorry, I got the phone. Can you turn that off? Or just, yeah, thanks. Unless it looks like anyone's urgently. So that's something that can be considered. I will say that one of the interesting things about these programs is that even under study conditions where they're getting paid to do this, 20% of the families drop out between the time that they, if the parent says, yeah, I want to do the study, 20% of the kids talk them out of it by the time they are going to get the camera installed. And it's, gosh, Mom, don't you trust me? I mean, this is so snoopy. It's just terrible. Another option is to try to do something better with driver's ed. And probably there's a lot more that can be done. Maybe we could teach people to scan better, scan on the sides through a video game technology. Maybe we could have, Mario Kart driver ed. And maybe we could do something that would help. There have been attempts to teach kids how to do more defensive driving and driving skills, and those studies were largely stopped because it turned out that it really just led to overconfidence. So, it can be a double-edged sword, and that's why it's important to study it.
Sounds like one of the answers is, even with driver ed, not to let them drive early.
That's right. And that's one of the things I think we're finding. When the studies all came out for driver's ed, as you and I probably remember, this was a part of our school, right? I mean, our school had driver's ed in it, or my school did. Because they're not effective, when schools are looking at budget cuts, many schools have cut these programs. So now they're private programs. People still feel like they should do them. And again, I think it's a convenience thing. Your kid has to log in a certain number of driving hours, and you probably don't have the time to do it because you're working on postsynaptic transmembrane potentials. So, so it is a convenient thing, and it's important to do, but, it'd be nice to do it better than we're currently doing it. So now it's largely a private market, but I think there's some creative work doing to try to make more a discussion between parents and teens and more of a compact. And then I think, basically that old slogan, trust but verify, there's probably work to be done there, which is going to help us on the teen driving.
What's the range of ages at which driving is allowed in different states?
There are farm states. Iowa, I think, lets you to get in right at the start of 15.
And on the upper end?
The upper end is 16, pretty much.
I thought New York was it?
I'm not sure.
New York City is. New York City is.
What about Canada has that big green N?
On your car. So, you know, yeah, I don't know if that's effective. It's an interesting point. I mean, it's the complicating factor has to do with whether it's your car, right? So you can identify this as a new driver, but for most people it's a family car. They may not want that on their regular vehicle. So I think, but there's some good points about some ways to identify that car. It would certainly help the law enforcement side because, again, you can't enforce this law because you really can't tell how old the person is inside the vehicle. I think another really new idea that will be important are electronic disabling devices. And there's a couple new things coming down the pike. When you think about it again, you realize how complicated this is. But some of these actually will jam cell phone transmission when the GPS-enabled phone is moving at more than 10 miles an hour. Okay? So people say, well, I want my daughter to have a phone, right? Because if she breaks down in the car, God forbid, she could call me, and I'd come to her rescue. And as I was discussing this with one of the epidemiologists, I mean, I would feel the same, but I bet you that if you really look at it, I bet you that phone, which you purchased for her safety, at the end of the day, makes her less safe. I mean, that is the truth. Is it still going to happen? Yes, it's still going to happen. But I think people do want a system, some kind of emergency system where they can reach their kid at any moment. One of the videos that you can look at here is actually the girl calling her father and talking with her father on the phone, and she runs into a car right in front of her. So, there are risks to being in constant contact with your kids. So this disables when you're moving. It can disable other phones in the vehicle, but that can be overridden. Ford is coming out with an interesting new program where supposedly the teen would have a special key. And that key goes in the car ignition, and when it's on, so you've got, the grown-up key and the kid key. Kid key has a velocity limiter, so the car won't go above a certain speed. It has a volume limiter for the radio, and it could jam the cell phone. So it's another interesting, sorry? If the car, yeah, but see, parents want to talk on the phone in the car, and they don't want to feel limited. They're happy to limit their kids, but they really don't want to be limited themselves. So, I mean, this is a lot of challenges you can appreciate,
But you made a great argument for just a simpler, low-cost solution, just not letting them drive.
You can do that, but I guess my point is, again, that parents, they aren't making these decisions for driving based on safety. They're making them based on convenience. That's just how it is. And all I can say, you have 3 kids, and little Johnny has to get to t-ball practice, and your big kid needs to get to her book club, and, her friend is going, and she's a straight-A student, So you send them. So I guess my point is, I wish we made all these decisions on safety, but we are fooling ourselves to think so.
A big argument you hear is for jobs. The kid has a job somewhere after school, and it's very important for them to have that income. Sometimes it's for the family, and so they have to use the car to get to their job.
Yeah, but there's a lot of people
There's
that
100
drive
arguments.
their car.
Well, there are 100 arguments.
But it's a very common argument.
But, we are a car society. Every year, our vehicle miles traveled goes up, except for, when the gas price really hits us. And we will continue for the short term and the foreseeable future to be a car society. So I think you as a family person, you can make some choices for yourself. And people are. There's lots of options. There's public transportation. You don't have to do this. But the general public is going to continue to do it. And we have to kind of, come up with some solutions for them, too. All right, so physical environment. I'm going to have to get a little faster. So our state, by the way, is considering a ban right now on text messaging. We are one of the few states that has no primary enforcement, which means they can't pull you over for this. I'm going to just...
Why is that, by the way?
Because they didn't think it would
Is there,
pass.
Cell phone lobby, or?
Yeah, everybody. People don't want it. They think, why should, I can choose myself when to do it. And that, there's 100 arguments. let's see, I'm going to skip a little bit. Well, I meant to show you that I've done a lot of work on booster seats. This is another example. You should be in a booster seat until you're 4'9". That's what the studies show. And that's about the height of a 12-year-old. So my poor daughter is one of the, probably Nick's daughter as well. We probably have the only kids who are still in booster seats, is to my knowledge. And I'm just going to show you what happens. And here's a little bit of head injury for you. This is a 6-year-old dummy. It's got the seatbelt behind the back. And you move forward quite a bit because there's slack in the shoulder belt. And I can tell you this isn't good for your brain. So basically you get slack from both systems, feeds into the belt system. Many kids can be ejected from this. I had a kid the other day, 3-year-old, ejected from the vehicle, supposedly in a seatbelt, but didn't stay in that seatbelt. So we've done a lot of work on trying to improve car seat use both for English-speaking and Spanish-speaking families. And we've really been able to do that. I mean, I think people need to know about it. It's a knowledge thing, but also an enforcement thing. The fine in our state, $141 per passenger in your vehicle who's improperly restrained. And that has teeth, and that makes a difference. So there's some interesting data on the vehicle mismatch. One of the I saw actually right before this, there were 2 girls who died, and both were able to donate organs. They were front seat passengers in a small sedan that ran into an SUV. And they were in the passenger side, and they had a vehicle mismatch, which is very common. It just came and rode right over the hood. Everybody else in the car was able to walk away from the crash. And it has turned out that SUVs have consistently raised their bumper height to the point that they don't match at all to the testing conditions that are done at NHTSA. And so it's an uneven match in a crash. That can easily be fixed in a regulatory form, but it needs to happen because it's a very dangerous situation. I'll briefly talk about a couple of the research projects that are going on just to give you a flavor, and because I'd love to have, I'm glad you're asking some questions. One is on sports concussions, a huge problem, 8.9% of all sports injuries. And what we're learning more is that concussion, which sort of has this, as you guys know, sounds like a minor sort of thing to parents, and it is not. And so we're the first state in the country to have the Zach-Lystat law. Soccer is actually the 3rd most common form of concussion injury, and it's the biggest form of injury for girls. So we have studies on soccer injuries and soccer head injuries, traumatic brain injury, and also looking at the impact of the Zachary-Lystat law. There's a lot of interesting work going on for older trauma patients. And one of the things we found is that it benefits you to go to a trauma center. It's a distinct advantage in survival. And that's true for all people under 55. But if you're 55 or older, going to a trauma center is a wash for you. Now, why should that be? 55, I'm almost 55. I mean, 55 is young. So what is it about, why aren't we doing better for older people? And what we see is some delayed mortality. We're going to have, we are a country that's going to have 100 million older people, and so we need to know how to help them best. There's some interesting research looking at inflammatory cascades. One of the things we suspect is that people are not getting on their baseline medications. Some of these have anti-inflammatory properties, like the beta blockers. And also, we're not reversing anticoagulation fast enough. So there's a number of medical things that we're going to look to do better on at the trauma center. There's cytokines that are associated with aging and maybe playing a role for older people. And then one of our investigators, Hillary Thompson, is looking at biomarkers to look at the function of illness and traumatic brain injury. Though I will say that part of her interest in this as well is what is the framework of care for older people that's leading to this poor outcome. Really, a trauma surgeon is making a decision for you about how aggressive to be for your care. And when you hear Hillary present, clearly there are some decisions that are being made by your care team, the person who doesn't necessarily know you, about how aggressive to be for your care. So my take-home point for that was to say, like Sudoku, and write it on your, a sign on your mom's chest if she ends up in the trauma center. It's important for people to know that you're a vital person because they're making decisions about how aggressive to be for your care. And part of that is really to think about if we could have an interdisciplinary team, could we do better on the care of older patients? I'm going to leave a couple of these things.
So what about the fact we don't like 15-year-olds driving? What about 90-year-olds?
There's a lot of interesting research on that as well. Interestingly, they do a better job than younger people at mitigating their exposure. So 90-year-olds, they know they're bad night drivers. And they try not to drive, at night. They really cut back on their exposure. So while their crash risk per mile is very high, their overall crash risk, they really bring it down by driving a lot fewer miles. But there's still a need to, to figure out what kind of testing we're going to do. These decisions are made for political reasons. They're not made for health reasons in most instances, and you can imagine why. So let's see. I think I'm going to... We have another study looking at what really helps you recover. And I'll just make one last comment and then end. Rehabilitation is so critical, and dealing with traumatic stress is so critical. One thing that I appreciate now is that your outcome and how you do when you go home, your functional outcome, is actually more dependent on your PTSD and depression than it is on the degree of your injury. And knowing that, we need to be very aggressive about screening people in the hospital and providing treatment for them. Because if we're really concerned about getting people back to work, this is not simply fixing your arm and fixing your concussion. So I think that's another area that we're learning. So I'll just leave with you with these take-home messages. I'm sorry I've gone a little bit long. And if there are any questions, I appreciate them.
So the teenage driver,
Yeah.
a risk to all of us
Yes.
and to themselves.
Yes.
Why isn't there more of a national movement to delay access to a car?
I think there are some national movements that are having that effect. And I think, taking away driver's ed is one of them. If you need a certain number of miles to drive, that's one of the things that's pushed back driving times. So I think it's had that impact. I think that this is a hard country to do that in, This is a country that believes in people's individual freedoms. And the bottom line is that it's also Lake Wobegon. I mean, every single person believes that their kid is a better driver than everyone else. And I'll give you the great, I love this. When you ask people, my neighbor said, can I have your crappy car? We were trying to sell our old car. Can I have my crappy car because my kids are going to, they need an extra car to drive. Okay, what are you really saying? You're saying, I think my kid's going to crash, and I don't want him crashing my nice car. So I'm going to give him a crappy car to drive, but you don't believe that he would be injured. So that is it's a psychological protective ability. So I think we're sort of struggling against that. Again, people, this is not a decision they make for safety reasons, so we have to find some things to do it. There are some potential legislative solutions, and maybe those will become more palatable with time. But it's a good question.
The argument I hear from people about driving and talking on the phones is that, well, isn't that the same thing as talking to somebody next to you, playing with the radio, eating? Are those as equal risk as talking on the phone?
Right. Well, there's some risk to doing all distracting activity. And there clearly, the risk, as best anyone can tell, is a cognitive risk of having your attention taken away. So while I think at the end of the day, it is going to show that there's some decrease in risk to have a hands-free set, but it's not going to be much because it's really not a physical risk, more of it's a cognitive risk. That being said, if you're a passenger in the car, if you're a noisy teen, yeah, it's really distracting, and that's why we have a graduated driver's license. But if it's like you and your spouse, that person in the car, when they know you're merging, they stop talking, right? You're kind of you're a cognitive person. When you see the person's not driving very well, you stop talking. When your cab driver is trying to turn around and look at you, you stop talking. So I think the risk of a passenger in there is less. But it's also simply exposure time. I mean, people are on that phone all the time, either walkers as well as the drivers, right? So
it's interesting. That's the same argument I made about somebody in the same car is watching the same things you are and modifying what they're doing.
Yeah, it makes a difference. I mean, either way, if all those things are risky, we'll try to do our best to, you have to start reducing risk, and you've got to start somewhere. And it's clearly a good target, I think.
The big part of this discussion is how, when you talk, obviously there's a lot of ways to modify behavior, but legislation is one of the ones you bring up quite often. And there's a huge debate on how invasive government and everybody else. And one of the things, I think what's interesting about Washington, and especially the Seattle area, is how you have this helmet law, and it seems fairly strictly enforced. It seems very good. But yet, smoking. People are smoking in no smoking zones all the time around here. and I see teenagers smoking all the time around here. So it's interesting that we've kind of chosen to hash that out, that say, no, you have to wear a helmet, which doesn't really seem that, that seems a lot more invasive to me than saying, no, you can't smoke that thing, it's going to kill you.
Well, they're all important
It's
public
actually
health.
going to cost us a lot more.
They're all important public health reasons. We're making progress on smoking, don't get us wrong. And cost is a big thing. So, I think thinking about economic incentives is important as well as the legislative incentives. But, they're all important. And another thing they share in common, risk messaging doesn't work for either one. So we need to learn that. Well, thank you all for your time. I appreciate it.
Theoretically, you're supposed to check to see whether Harborview has some questions for you. You need to take down your
I'm sure they do have.
thing.
They may have before 6 o'clock, but I doubt they have.
The other one on the left.
All right, who's going to dinner?
Yeah.
That's a great question. Well, it's an interesting question. Sweden is going for, and actually we sort of have this anomaly, but they're going for a target zero strategy. I mean, the Netherlands countries, they are telling us we will achieve zero fatalities for traffic. And it's a global strategy. One of the things we talked about in Washington, everyone's like, how can we make cars safer? Well, I'll tell you one thing, get people out of them. I mean, you need to have that discussion with public transport because it's a lot safer. So if you got 10% of the people out of vehicles, you'd reduce your driving risk by 10% right there. So the kind of collective strategy has been really interesting with public transportation, pedestrian safety, vehicle safety. Volvo goes and personally investigates every crash involving a Volvo in the country of Sweden to figure out what risk factors could be done for the car. So Europe is far ahead of us on almost all of these measures.
And it's way more expensive to get a driver's license. In Germany, it's about $1,500.
$1,500?
At least.
Wow.
Maybe 2,000, depending on how many hours you
Wow.
do. Very
Thank you
expensive.
all.
We don't even know how to be so.